Hi, folks. We're just going to get started in a couple of minutes. We're just seeing people come in. We'll get started in a minute. All right, we'll have some folks probably starting to join. Let's get started. Ani, Buzu, Sego, welcome to our healthcare launch event for Do Better. Thank you for being here, for everything you're doing to support our province right now as healthcare workers. Also want to acknowledge how hard this past week has been, which is a weird thing to say in a year where everything just seems hard. But between all the public health policy decisions in Ontario and the amount of death that we're seeing on our social media sources, I just appreciate folks wanting to come to this space to hopefully learn how to do better for 2SLGBTQ youth in Ontario. I want to start this event by naming that the land we work and live on throughout Ontario is colonized land and is home to many Indigenous territories. I, as well as YouthLine's head office, are situated in Tekaronto, which is the traditional territory of the Huron-Wendat, the Haudenosaunee, and most recently the Mississaugas of the Credit River. Can I just get the slide to move to the next one? Thanks. I also wanted to pause and be like, oh yeah, I forgot to introduce myself again today. My name is Burka. I use they, them pronouns of the Executive Director of YouthLine. And I also wanted to name that there is closed captioning. So if you go look at the bottom of your bar, you can see live transcript CC. As the participant, you get the choice if you want to turn it on or off and how you would like to see it. So I want to offer our gratitude and solidarity to the Indigenous people who have and continue to care for, protect, and defend this land. Although it is important to acknowledge the land, it's only a first step. We're all treaty signers and are thus responsible and accountable for the violence that Indigenous people face. Colonialism is ongoing, and Indigenous land and people still continue to be attacked. Today, as we have conversations about the Do Better report and the 7 recommendations, specifically in relation to health services in Ontario, it's important to name that health services throughout Turtle Island have a long and violent history of anti-Indigeneity, colonization, and genocide. In Ontario, Indigenous people continue to experience the lowest health status of any identifiable population. As we continue to work to support the 2SLGBTQ youth, it's also important for us to acknowledge the ongoing harm through the systems we work in, to continue to understand our history and take action to decolonize our work in spaces, which includes building cultural competence, recognizing and making space for Indigenous traditional healing. This also includes supporting Indigenous movements across Ontario, many of which are led by Two-Spirit, queer, and trans Indigenous youth. And I know the different panelists will talk about this more today as well. I wanted to get us started with some housekeeping. If this is your first time being on a webinar, just a note that at the top, you will see something that says view. Our recommendation is to do side-by-side speaker view, which will let you see the screen shares as well as who has been spotlit throughout the presentation. At any point, you can also move to gallery view and you can hide all the folks that don't have their cameras on to just see who is visible. If you have any questions throughout the webinar, we have the Q&A section open, so you can send us questions about tech issues or anything coming up for you that we can respond to privately. Christia is supporting our tech today. The Q&A is also where you can ask us questions about that for us for later on when we do the Q&A segment. I'm going to pass it on to Haley now to move us to the next place.
Awesome. Thanks so much, Burka. So hello, everyone. Welcome. We're so happy you can join us. This is our second webinar for our virtual tour of our Do Better report. So today we're focusing specifically on the healthcare sector, and we have an amazing lineup of speakers over the next hour, and I'm going to get into that soon and share a bit about the agenda. But first, I should introduce who I am. My name is Haley. I use she, her pronouns. I'm coming from Saugeen territory, Gitche, Nimiquoddong, or Owen Sound, and I work at YouthLine as the manager of engagement and partnerships. So a teeny tiny intro to LGBT YouthLine for folks who don't know about us. So we're a 2SLGBTQ plus youth-led organization that affirms and supports the experiences of youth who are 29 and under across Ontario. We've been in operation for 27 years, and we offer multiple different programs, including an anonymous peer support line, a resource database, and multiple 2SLGBTQ plus youth leadership programs. So we only have 1 hour together and we have a jam-packed schedule. So just to briefly give you a sense of what we're going to be doing today, first things first, we're going to have an overview of the 7 recommendations as presented by 2 individuals who have been there from the very beginning creating these. Next, we're going to move into a youth panel, which is going to take up the majority of our time together. So we're going to have some amazing people just share their insights, experiences, thoughts about the recommendations in relation to the healthcare sector. And then at the very end, we will have a question and answer period where folks in the audience, you can ask us questions. So as Burka named, there is a little tiny Q&A box on Zoom. Feel free to pop your questions in there, and we will try to get to them, whether live or through typing back to you. So first, I'm just going to do a little tiny quick history of the report. If you wanted to move to the next slide. Perfect. So why we're here. So just a bit of the history to tell you how we got here with this report. So in February 2020, LGBT YouthLine released results from our 2SLGBTQ plus youth needs assessment. And that needs assessment was called We're Here, 2SLGBTQ plus youth across Ontario assert needs and experiences. So one of our leadership programs, the Provincial Youth Ambassador Project, led the needs assessment and was able to gather responses from almost 1,200 youth throughout Ontario. So based on the needs assessment reports launched in 2020, our team began to imagine recommendations for how to move forward. The demands of the youth from the needs assessment were clear. We need change in Ontario. We need services, support, sectors, politicians, those in positions of power to do better, because to us, LGBTQ youth deserve better. Which brings us to our report, as you can see here. So I'm going to pass it over to 2 of the most amazing humans to share those recommendations, Anu and Shivani. So a little intro. Anu has been with us since the very beginning of the research project in 2019 as the lead research consultant, supporting YouthLine staff and youth ambassadors in the original youth needs assessment and taking the lead on the recommendations report. She has been an integral part of the team, pouring so much time and care into every step of the way. And Shivani, who's also been with us since the very beginning. In 2019, Shivani started as a youth ambassador, taking a strong lead on the needs assessment creation, delivery, and analysis. And in 2020, she moved into the operations coordinator role at YouthLine. So I think you are all really lucky to be hearing from these 2 amazing humans, and I'm going to pass it over to them.
Thank you, Haley. I always love hearing Haley's beautiful bio. So I'm going to get straight into the recommendations. Our first recommendation is about the healthcare system. Redesign health system services and programs for 2S LGBTQ plus youth, especially mental health services and care for trans youth. I also think it's really important to name that when we were working through and planning these recommendations, this recommendation was purposely put as the first recommendation. It wasn't first when we started, but as we talked through what we wanted to see in these recommendations, myself, as well as the other youth ambassadors at the time, really pushed for this one to be number 1, because a lot of folks felt like this was one of, if not the key barrier for so many to us LGBTQ plus youth. And that is because the healthcare system is failing to us LGBTQ plus youth. We are disproportionately impacted by health-related issues, and we are not getting the support that we deserve. And what does this mean during a pandemic? It means that with health clinics being repurposed for COVID response efforts, 2S LGBTQ plus people have to travel further for treatment and care. It means gender-affirming surgeries are being delayed which has serious impacts on trans folks. It means that 2SLGBTQ plus youth need to see change now more than ever. And I know we'll hear a lot more about this and the experiences from the panelists today.
Greetings, folks. I'm Anu or Anuradha. My pronouns are she and her. It's an honor to be here, especially as a consultant. Sometimes you do the work and it kind of has a life of its own. Gratitude to YouthLine folks for bringing me back in. Recommendation number 2, in suburbs, smaller cities, towns, and on reserves, intentionally dedicate resources, so that's space, time, energy, as well as funding to directly support 2SLGBTQ plus youth. During the pandemic, certainly, but pretty much all times, for 2SLGBTQ youth, where you're located in Ontario makes a huge difference in terms of services, programs, finding and building community, and more. We know that some urban centers in Ontario are pretty well resourced. You could find a doctor, you could find an agency to go to a drop-in or a virtual program. You could find spaces to kind of hang out also. In other parts, not quite the case, and people make plans to leave where they grew up. Where Shivani and I are from, in Peel, we could pretty much tell you that pretty much every other month someone leaves to go to a bigger city like Toronto, even though we're right beside it. We know that in places like the suburbs, smaller cities, towns, and on reserves, 2SLGBTQ youth have been advocating for resources to come directly to them and advocating for a long time. There's often little to no money available or allocated. And so this recommendation is really saying to those with power over budgets, they need to do better.
Recommendation 3, develop mechanisms for grassroots 2S LGBTQ plus youth organizing to access much needed resources and supports. According to the needs assessment, 55% of youth have not accessed a 2S LGBTQ plus space. It's not just about the existence of spaces and resources, it's about who has created them and why. You can find this quote from the needs assessment on the Do Better website. And I think it really speaks to what 2S LGBTQ plus youth are looking for when accessing resources and supports in Ontario. The quote reads, "It's about the community, not the credit. Focus on making positive collective change through collaborative work, rather than minor deliverables with your name on it." The only places in Peel where I have personally felt safe and seen as a queer person of color exist through grassroots organizing, and I wasn't able to access them until my early 20s. Top needs that 2S LGBTQ plus youth addressed in the needs assessment to access services and spaces are low to no financial cost, being in close distance, confidentiality, and youth-based spaces. And these cannot happen without developing these mechanisms for grassroots organizers to access resources and support.
Recommendation number 4, the meaningful involvement of 2SLGBTQ plus youth, especially racialized and Indigenous 2SLGBTQ plus youth, in decision-making at the local, regional, and provincial levels. Tokenism is not what 2SLGBTQ plus youth want, need, or deserve. The feeling that many of us are having right now that the government may not be caring about what we need, this is something that so many 2SLGBTQ plus youth have said in the needs assessment over and over again. This recommendation is an opportunity to change things up. For those of you who work in mainstream healthcare, you might have a patient advisory council or some other way of ensuring that you're providing patient-centered care. I'd ask the question, what would it look like to have 2SLGBTQ youth at those tables, on those councils, and not just there, but to truly honor the 2SLGBTQ plus youth perspective?
Recommendation 5, proactive efforts to increase 2S LGBTQ plus youth representation in positions of power and influence. Services, resources, supports, spaces. None of them can be created for 2S LGBTQ plus youth without consulting 2S LGBTQ plus youth. I remember going through the responses on what 2S LGBTQ plus youth want to say to decision makers and reading over and over again that youth want to be a part of the decision-making process for anything that involves 2SLGBTQ+ youth. And it's just so important that racialized and Indigenous 2SLGBTQ+ youth are prioritized in these conversations.
Recommendation number 6, mandate change in building and facility standards to have safe, accessible, all-gender washrooms in all public spaces in Ontario, including on reserves. This is essentially about safety. The lack of all-gender washrooms in public spaces, including healthcare spaces, creates unsafe situations. It's beyond time for this to change. Gender identity and expression were added to the Ontario Human Rights Code in 2012. We're almost 10 years past that time, and yet public spaces like schools, community centers, and more continue to fail 2SLGBTQ youth and folks of all generations. In my own organizing, grassroots organizing in Mississauga, for example, over more than 5 years, we pretty much were only ever in one community space that had all gender washrooms. It's time for this to change.
And our 7th and final recommendation, comprehensive and ongoing training and capacity building focused on supporting 2SLGBTQ+ youth and challenging homophobia, biphobia, transphobia, and racism. When I was a youth ambassador in 2019, I shared a house with around 20 other 2SLGBTQ+ youth during our opening retreat. I remember listening to and sharing stories and experiences about how just the lack of understanding from service providers, healthcare professionals, educators on how to support 2SLGBTQ+ youth just creates and adds onto our traumas, impacts our health, especially our mental health, and increases the violence on 2SLGBTQ+ communities. This was a very brief overview of the 7 recommendations on how Ontario can do better. If you have not already, you can read through each recommendation along with statistics and quotes from our needs assessment and suggestions and examples on how to implement each recommendation on the report website, dobetter.youthline.ca. Now it is time to move on to the next portion of the webinar. I'm so excited to have the opportunity to introduce the amazing individuals in our 2SLGBTQ+ youth panel. They'll be sharing their thoughts about the recommendations and how the healthcare sector can do better. So without further delay, let's meet our moderator. Nanki Rai is a migrant settler from India-occupied Kashmir, who was formerly trained in public health and practices as a primary care physician in Toronto. They work closely with 2SLGBTQIA+ communities, including Black, Indigenous, and other racialized queer, trans, and gender nonconforming people, people who use drugs, and people who are unhoused or undocumented. She has been active in anti-colonial and anti-imperialist grassroots movements for migrant and health justice for over 10 years. As the 2SLGBTQIA+ health theme lead for the medical school at the University of Toronto, Nanki is committed to building anti-oppressive medical education and clinical practice.
Thanks so much for having me. I'm so excited to be here today and particularly really excited to learn directly from all the 2SLGBTQIA+ youth who have come together, not just for the panel, but all of the 1,200 plus who have submitted their responses to the report that led to these recommendations. I think particularly, in moments like this when we're surrounded by so much suffering and harm around us, I really appreciate being able to take the time today to just learn about creative and necessary solutions that have been brought forward by youth as well. So as you've heard from my introduction, you can guess I am someone who's deeply embedded within medical establishments at this point in my career, and I'm also someone who continues to engage in grassroots activism. I think, part of the reason for that is because my experience in both institutional and community spaces has always taught me and has always reminded me that, whenever any positive change has occurred towards improving the health and care needs of 2S, LGBTQ youth and communities broadly, it's because of collective action that people have taken to resist institutional violence, and that includes in healthcare and beyond. And that it's required community resistance and resilience in demanding for change in order for us to see that change come to fruition. So I just wanted to acknowledge that. And I think also really important to acknowledge that those who've been most pushed the margins of power within not just our society, but also within the broader 2SLGBTQ communities have also been the ones who have led a lot of this change-making work. And I think the same continues to apply with this report and the work that is being done by the youth as well as LGBTQ YouthLine today. So with that, I just wanted to express my gratitude to the youth and to all the staff at YouthLine, as well as facilitators and consultants like Anu, who have come together to do this work. I especially wanted to express my gratitude for the clarity and the precision with which the Do Better report has put out there and articulated the recommendations and the problems as well as the solutions. I think the thing that stood out the most for me was the commitment to ensuring that those who face the most compounded harm due to intersecting forms of violence from capitalism, colonialism, anti-Blackness, anti-Indigenous racism, ableism, xenophobia, and so much more are seen as central to the planning and implementation of the solutions. I think this makes complete sense to me, recognizing that those who are closest to the problems are also the ones who are closest to the solutions, and we need to continue to amplify that and center that in our work. So with that said, I would like to introduce the panelists today. I will start with Vincent. So Vincent uses he, him pronouns, and he's a medical student at Queen's University. Vincent has a keen interest in 2S LGBTQ health, translational research, and youth programming. During medical school, Vincent has led the LGBTQ+ Health Committee and was a youth group leader in the local 2S LGBTQ youth group in the Kingston community. In 2020, Vincent also served as the regional assistant for LGBTQ YouthLine as part of the Provincial Youth Ambassador Project. In this role, Vincent supported youth ambassadors across Ontario as they developed projects for their local communities aimed at increasing 2S LGBTQ health programming and building networks among youth. Next, I'd like to introduce Cameo. Cameo uses they, them, and he, him pronouns, and they are a white, disabled, non-binary, trans, masculine, queer, currently situated in Thunder Bay on the traditional territory of the Anishinaabe. Friends tend to describe Cameo as succinct, passionate, and just a tad angry, which I can definitely relate to. They spend a lot of time spoiling their cats, playing board games with their platonic soulmate, and dreaming about the resurgence of the barter system resulting in the subsequent destruction of capitalism. Can also relate with you on that. So next, I'd like to introduce Abby Lee. Abby Lee uses they, she, and they, them pronouns. And they are a Lebanese Canadian person who is continually motivated by all things community oriented. Currently, she works as the audience engagement coordinator at the Art Gallery of Windsor and volunteers as an Ontario network representative with jack.org. As someone fascinated by many different sectors, Abby Lee has worked in marketing at the Stratford Festival and the Sundance Film Festival. She's created wellness initiatives with jack.org and LGBTQ YouthLine, and has worked as a historical interpreter and tour guide at Fort Henry and the Haunted Walk of Kingston, which is so fascinating. I will ask you more about that later. In their spare time, you can find Abby Lee singing too loudly to the Hamilton soundtrack, eating Lebanese food, or watching Schitt's Creek for the millionth time. So wanted to introduce you all and really excited to be in conversation with all three of you. And I'll just jump right into it and ask you the first question. And so for the first question, really just wanting to frame it as, what are some of the most pressing recommendations that have been put forward that have asked to, let me rephrase this, hold on. I'm like, there's like two questions in one, so let me bring it together. So one of the most pressing recommendations has been to totally restructure the healthcare system so that it stops failing 2S LGBTQ youth and people in general. Where do you find yourself in this conversation? Feel free to share your thoughts based on your experiences as a young person accessing healthcare, but also feel free to share your thoughts as someone who also volunteers or potentially works within the healthcare system as well. So maybe we'll start with Cameo.
Sure. So I find myself on the side of more of like the necessity of a total restructure. I work as a support worker in healthcare, and I also volunteer with a lot of youth programs. And as someone who works as a healthcare provider, I find myself trying to better the system from within to the best of my ability to better serve our clients and people accessing care and support. But I find that that can only work to a certain extent in a system that's just fundamentally flawed. There's something to be said about the change it from within angle. You can only change things to a certain degree when you're in a position upholding some of the same violent power dynamics that you're aiming to get rid of in the institution. And it's my opinion that if you're contributing to the system, you can only change some aspects of it, but not necessarily the basis of it. And unfortunately, the basis of our current healthcare system wasn't really made for us. It was made to serve people who are in greater positions of societal power, not necessarily the 2SLGBTQ plus youth or the trans folks or the Black and Indigenous people or disabled folks. And a system that's not really made for all of us doesn't help any of us. It's not accessible, inclusive, and competent, then it's more of a failure. And unfortunately, that's kind of what we have here. So we need to do better. And I see that being done best with an overhaul of our current situation. Because we need mental health supports and competent trans care, access to transitional tools, doctors and specialists who are already trained and aware of our needs. We need traditional as well as Western healthcare supports, which is something that was mentioned in the report's recommendations. We need to decriminalize drugs, and there needs to be medical coverage for literally anything you need to better your mental and physical health. I think that the list just goes on, and when you look at your list and what it can do, it just results in a system that could be so much more beautiful and so different that you might as well just rebuild it.
Thank you so much. There's so many thoughts that come to mind when you talk about that. I think, oftentimes we also talk about Tommy Douglas, for example, as the father of Medicare, but what we don't often learn about is that he was also a eugenicist and, early in his career advocated for sterilization, legislated sterilization of people he thought were subhumans. And of course, he defined that as people who were Indigenous, people who were engaged in sex work and in the sex trade, people who were queer and trans, people who were disabled, people who were migrants, particularly with disabilities. So I think you really hit the nail on the head there when you're saying this is the institutions and the entire system in its founding and its roots is deeply rooted in colonial and capitalist violence and all the intersecting forms of power that get created within society to maintain those infrastructures. So echoing that, hearing it, I'm really excited to hear what Abby Lee, maybe we'll go to you next. I'm not sure if we can hear you. Let me. Maybe while Abby Lee is sorting out sound, we'll go to Vincent in the meantime.
Sure. Can you hear me? Yeah. Hi, I'm Vincent. I'm a medical student. I go by he, him pronouns. I guess my perspective is more biased towards medical education, but I remember growing up and having a practitioner, and they would ask me every year if I had a girlfriend and if I would engage in sexual practices. And I would say no, really scared to accept my sexuality. And then the conversation would end there. And I remember thinking that I needed a new practitioner for like a decade, like over a decade. I had this practitioner for a really long time. And the second I started my master's in Toronto, as a lot of people who go to bigger cities do, I thought now's the time. I'm going to go to a 2SLGBT oriented center. I decided to go to Sherborne. And then I got into medical school and I was excited to, implement some change and see what my peers were like and see what medical education can teach to kind of change the practices that a lot of practitioners have with 2SLGBTQ youth. Unfortunately, the school I go to is not a large city like Toronto. And I was actually really disappointed to see that there was less than 1 hour of medical education related to 2SLGBTQ youth and care. And I think a huge problem from my perspective is asking the vulnerable people to share their trauma or share things they don't want to share as an educational tool for others. So I remember even when our facilitator for that 1 hour session asked us if we had anything to add, my entire class turned around and looked at me. And the facilitator actually said, Vincent, do you have anything else to add? Just because there was so little visibility in my class, there were so few queer individuals in my class that and this has been a persistent issue in our school where year after year, the members who are of our class who are openly out and queer were asked to share their personal experiences as an educational tool. So I did lead the LGBT health committee at my school. But again, it's hard as a junior trainee to lead sessions or workshops on different topics that should really be part of every practitioner's wheelhouse of expertise. You would never ask a practitioner, oh, you don't know about high blood pressure, or you don't know about diabetes. And these things are impacting the community, and they do have health consequences as well. So it's really disappointing to see that. And when it's not mandatory in a curriculum and you're offering these sessions, a lot of the people who are attending are the folks that would seek that information on their own. So we're not really getting to teach and provide these resources to people who need it the most. And those are the people who wouldn't necessarily seek that information or don't always think of it as important. Yeah, so there's a lot of work to be done. And I think, unfortunately, at some schools, there's not someone like Nanki at the school that can kind of be part of that change. It's hard because I know at U of T, they have Nanki's role that is important to integrating 2SLGBT themes throughout the curriculum. And I think an issue I wanted to bring up is that we're often seen as other, like supplementary information, or, but there is topics throughout medical education that can touch on this and should be. Even designing a curriculum for a sexual education initiative, I was told that, we would prioritize the heteronormative content. And then if there was time, we would discuss this other content that I had developed. So that idea of being on the side and being other or being additional, which I think is a huge problem. Okay, I think I talked long enough.
Yeah, thank you so much. I mean, so many thoughts come to mind when you're talking, and I just wanted to flag, my role at University of Toronto is one particular person, and again, it's this patchwork of, well, let's have one individual somehow be representative of the entire diversity and beauty of 2SLGBTQ people. And similarly, when I stepped into my role, it was still standalone lectures on queer and trans health. And then, they would listen to a lecture maybe by me or the people who were in my role previously. And then right after, they would have a lecture on gynecology, and everyone would be just gendered in a particular way. Only women get breast cancer or chest cancer. So it just, all of the rest of the education just ends up undermining that one lecture of education when cisnormativity and homophobia are just so deeply integrated into the curriculum. And yeah, so the work needs to be more transformative, and it needs to go across the spectrum. I think the other thing that you brought up that really hit home for me was just the idea of so many of these lectures also end up focusing on the suffering and the spectacle of suffering. Like, look at how badly people are doing, and that is somehow the only way you're going to care. And most of those conversations don't actually, speak about the arbitrators of the violence and the structures of violence. And I think that continues to absolve the responsibility for those of us who then end up in medicine, who are inheriting that legacy of medical violence. And so there isn't a lot of work done to actually hold a mirror up onto ourselves as people within the institutions. And again, more just a look at how bad things are, this very charity model of care, which is so fundamental to how our healthcare system is currently set up. So really excited to hear and see the work that's being done to really push forward for a really different fundamental on changing that. Okay, Abby Lee, are things good on your end?
Hello, can you hear
There we
me?
go.
Oh, brilliant. Okay, wonderful. So it's hard to act to follow with Vincent and Cameo, but I'll do my best. So I'm in a bit of a different position. As mentioned in my bio, my full-time position is more so in the arts, but in terms of volunteering, volunteered with LGBT YouthLine, and I currently volunteer with jack.org, which is a youth mental health organization. So definitely having a lot of the mental health advocacy and resource conversations in those roles. And it seems that in the conversations that I have, what consistently comes up is that there are organizations doing the work to provide mental health support, but they're often smaller and often working in isolation. So there's no sort of larger interconnected framework of mental health support where, say, if somebody needs to access care, they can go to a service and have sort of an interconnected system of support at their disposal. What often does tend to happen, I'll go into this a little bit later on, but people can fall through the cracks very quickly if they're not in crisis mode, and sometimes even then, because things tend to be very siloed. So that, at least to me, as in more of a volunteer capacity, that's something that I'm really hoping does shift, although change at that level, it is slow. It takes a lot of time. So until, hopefully we get to that point where there is that larger system of support at play, throughout the province and perhaps even beyond that, really try to focus some energy into the things that we can impact. So LGBT YouthLine has been a wonderful example of this. They provide such a wonderful space for folks within the 2SLGBTQ plus community who have the capacity to volunteer to provide peer support, that critical wellness support and community that is so important for health, as well as providing resources to allow young people within the community to create projects of their own that are beneficial to health. That is really wonderful to see, even though of course we're not there yet in the grand scheme of things, that it's really heartening to see these smaller organizations powering through and doing the good work with such force. And the last thing I'll speak to in this question is working in the arts. I'm really heartened to see the interconnectedness that has come up between the arts and health and wellness. So I work at the Art Gallery in Windsor, down in Windsor, Ontario. And while, we're not a service provider ourselves, it's been a really lovely experience, especially during this time where we all need some more wellness and support as we're in sort of our own silos in our own homes. Being able to connect with others in the community who can provide that support and join together in community collaboration to provide some artistic opportunities, but then also wellness programming to complement that. And it's been really heartening because there's definitely a need for it. We see that every weekend when we have these programs. And so I'm hoping to see that continue to flourish, as well as the more macro health systems hopefully continue to propel forward with the recommendations from Vincent and Cameo, because I stand behind those.
Yeah, I mean, when you first started, you were like, I'm someone who doesn't necessarily work in health. I work in the arts field. And I was like, all of that is so deeply integrated into health and wellness. So I appreciate you making that connection for us as well. Just for sake of time, I'll move on, and maybe I'll ask a particular question that, we'll go to the question around the Yukon recently having updated their trans healthcare policies. And I know that a lot of people are describing them as some of the most progressive in Canada. And for those who haven't seen this change, there's a recent article published in Extra by Faye Johnstone on March 30th. And maybe I'll put the link in the chat for others, or maybe somebody else can put the link in the chat for everyone to see. But I just wanted to get your thoughts on what are, even 1 to 2 things that you can think of that you feel, if implemented right away, could actually have a huge life-changing impact for 2S LGBTQ plus people in Ontario. And maybe we'll go the same route. Maybe we'll go to Cameo first.
Universal basic income.
Amazing, clear, concise. I love it. Perfect. You also said decriminalize all drugs, so I'll just bring that back in from the previous answer and add that there too. Abby Lee, did you want to go next?
For sure. So a couple of things I can think of. Having access, we kind of talked about this or Shivani, I think, touched on this at the beginning, but having accessible trans, non-binary, 2S LGBTQ plus affirming health clinics. I've spoken to people who travel 2 hours each way to get to a doctor that is affirming for them. And that's just so much money, time, and effort that could be saved if there were more accessible health clinics. And the second thing I'll bring up, a bit of a shout out to an organization in Windsor that I know of called 514. They're this wonderful organization that provides 2SLGBTQ plus or access to 2SLGBTQ plus homes or friendly, supportive, affirming foster homes for youth. So I heard of that and I'm like, this is such a life-saving thing for youth, especially since, you know, queer youth are at a disproportionately high risk of houselessness. So like having organizations like that can really save lives.
Thank you. Thank you so much for that. And Vincent?
I would echo the recommendations report. I would say access to mental health services for everyone. That isn't a barrier financially. And the second thing I would say is having funding available for people to travel outside of their community to access care if they want to. Because I think a huge issue is, you know, not having a provider in your community that can provide the services you need. That could be life-saving often. But also not having that reimbursement to be able to travel somewhere else. Like that is a significant barrier for people as well. So supporting that journey if people want to take it.
Okay, I appreciate all your succinctness with that question as well, because I did ask for it. Okay, I'm going to shift gears and maybe just talk a little bit about the pandemic, the reality that we're in. And we know that the pandemic has only exacerbated the challenges people have in accessing care, particularly Black, Indigenous, and other racialized communities, and especially, you know, BIPOC trans people, really all trans folks. I think the pandemic has highlighted the lack of trust communities have with the healthcare system. So I wanted to ask you, and it's a bit more of a personal question, so feel free to just share what feels comfortable for you to share. But what do you feel needs to happen for you to be able to trust healthcare providers and healthcare system in general? And maybe we'll go a different route. Vincent, why don't I go to you first?
I think the thing that I would appreciate the most is diversity at all levels of medicine right now and healthcare. So I don't see it in my class and I don't see it, you know, in the hospital or at levels of leadership, but I think for me, it's been disappointing to not have people who are in positions of power represent the community, because how can we serve our community if we don't have any members of the community at the table? So that's been really disappointing for me. What else do I need to trust the healthcare system? Yeah, come back to me. I had another one, but I forgot it.
No worries. Maybe we'll go to Abby Lee.
Sure. So I can speak more to, again, the mental health care side. So this particular point, it's not necessarily specific to 2SLGBTQ plus folks, although like I, as a member of the community, have experienced this. So I find that oftentimes when you go in to receive mental health care support at a professional level, which also is, I'm going to make mention, is very intimidating and can be very scary. For myself anyway, I've been to counselors at like very, very low points and just had them be like, oh, well, like you look fine. Or like, oh, well, you know, you're not as, you know, bad, which is not great language. It's like some other people that have come through our doors, which is such damaging language on many different levels that we don't have time to get into today. And so when you're in your most vulnerable moment and you feel like you can't, you know, you don't know where you can go to feel fully seen and heard and supported by like somebody who is supposed to be a professional in that field, someone who, like Vincent touched on, like more healthcare wise, supposed to like have knowledge of, you know, people from like many different experiences and their concerns, who then like can't see you, like that can feel so isolating. So really, I think having that in place would help me trust the mental health care system more, if that was like more, you know, that way across the board. I'll drop like 2 really quick resources here just for time. So there's an app that is coming soon called Runaway, and they're at runaway.app on Instagram, and it's a free 24/7 peer support app where you can talk to peer support volunteers, and their motto is making the world happier. It's very cute, it's very like inclusive and wonderful. And then There's another, of course, LGBT YouthLine, definitely, definitely there for Ontario 2SLGBTQ plus youth. And then there's also Ayana Therapy, which provides culturally relevant and financially accessible counseling. So all great resources. I hope that more can kind of take from their examples. Yeah, so I'll pass it over to Cameo.
Yeah,
So there's a couple there's a couple things that could like give me a little bit more faith in our healthcare system and to kind of reestablish that relationship there. I think that it would start with like adequate and competent training for all types of healthcare and health service practitioners, not just like doctors and specialists and nurses, but also like therapists, social workers, peer supports providers, like dietitians, nutritionists, anyone who works with people and deals with their well-being should have some sort of basis of education and awareness that they can draw on to begin having a better understanding and more adequate support of people that they are helping. And while that's all helpful and necessary, I don't think that training alone can completely reinstate my faith. As I mentioned before, the system honestly it just needs help. It needs to be restructured. Got to redo it. Got to redo the whole thing. And while you're doing that, I think it's incredibly essential to consult with marginalized folks to determine their needs and then genuinely work towards them. So that's talking to disabled, racialized, Indigenous, rural, trans, and Two-Spirit youth. They need to be consulted and involved in the decision-making process and also paid for their contributions and for their labor. I think that the two important things with that plan are also just like the absolute listening and like acceptance and realizing what folks need, and then the follow through to actually give them what they need instead of give them what you think they need, which are two very different things.
Thank you so much. I think for me, really the heart of that is how do we build healthcare systems and providers across the board that truly, respect people's autonomy and right to self-determination. And I think completely agree that the work needs to be to dismantle and rebuild. And while we're doing it, one of the ways that I often think about it is what are the actions I'm engaging in that actually lead to non-reformist reforms? And by that I mean, what are some changes that I am supporting or working towards that actually take power and resources away from these institutions and back into communities in order for us to kind of lay the groundwork for the dismantling, as opposed to just engaging in change that just reaffirms the institution's hold on communities and power. And gives it more legitimacy. So I think that's something that I'm kind of taking away as I hear you all speak today too. And I'll go back to you, Vincent, in case you did remember what the second thing was that you wanted to share about it.
Yeah, so I did remember my second thing. Thank you for giving me the second chance. So I think one other topic, going back to the feeling of being in this other category, a lot of the times, I feel like something I need to trust healthcare again is more awareness within healthcare and just any services that a lot of this care is essential and life-saving. I think even with COVID, a lot of the surgeries being booked or kind of deeming what is essential right now and what is elective or another thing or good to have that can wait. And I think there's just a lack of awareness that gender affirming surgeries and a lot of these other surgeries are life-saving, and they are important for people and populations that handle a lot that deal with a lot of violence on a day-to-day basis. So I think just again being more aware throughout the entire healthcare landscape that these components of care are essential.
Yeah, thank you so much for that. I think that's I think it's a great place to maybe wrap up our panel and bring LGBTQ YouthLine staff back into the conversation. But just wanted to thank all of you for sharing all of your thoughts and brilliance with us. I feel like I've learned a lot, and it kind of boosts my energy again to continue doing this work because it does require all of us coming together to push and resist and build autonomous structures like LGBTQ YouthLine simultaneously in order to ensure all of us continue to remain here. So thank you to all of you. And I really appreciate being invited to moderate this conversation. So I'll send it back to you, Haley.
Wow, what an amazing panel conversation that was. Thank you so much to all four of you for sharing everything that you've shared and sharing stories, sharing bold statements, talking about reform and abolishment. Like, I am so here for these conversations, and I am getting like text messages actually at the same time of folks who are in the audience who are saying things like, this panel is life. So thank you so much to you all. There's also been a lot of really amazing questions coming in, but we only have about 10 minutes left. So I'm just trying to sort through them and kind of pick what ones might be the most helpful for the most amount of people. So Nanki, this is actually going off something that you had just mentioned right before this panel closed, but I want to pose it to the entire group. So YouthLine staff, Anu, panelists, Nanki, please, if you would like to respond to this question, just turn your video on and we will spotlight you. So do you think the current systems and institutions need to be completely dismantled and rebuilt in order to ensure our youth can access these spaces and services safely? Or are there ways it can be modified? So I was hearing lots of conversations around like, you know, like let's like basically the healthcare system needs to be completely reformed. But are there ways that things can be modified currently to make sure that our youth can access these spaces safely? Is that a possibility? Nanki, yes.
Yeah, I'm happy to share my thoughts and welcome others to add their thoughts to this too. I think the reality is, you know, I find like inside and outside system thinking a bit challenging, and I don't find it as helpful for me. I kind of see it as we need to be able to meet the material needs for all of us in the here and now. And while we're working towards that, we also need to ensure that we can radically dismantle and rebuild institutions that will actually continue to grow and build, that includes all of us, as opposed to that continues to harm all of us. And so what that to me looks like is, are we still doing what is necessary within the institutions that are providing care to actually expand access to quality providers, and to actually being able to, you know, increase funding, increase the integration, like all the things that the youth on the panelists, all the panelists already brought up in terms of the need for mental health care that's immediate, that's actually culturally safe, and that's actually grounded within community knowledge and expertise and peer support, and have the resources to actually fund that. So for me, part of what dismantling the institutions looks like is actually pushing for institutions that continue to cause harm to redirect their funding, to redirect their money towards organizations and towards individuals and spaces that are actually doing the good work in the here and now. And that to me is a strategic demand and strategic work that we need to do that also ensures that those very institutions that continue to cause harm are being dismantled in the process. So hopefully that makes sense and resonates. I'm here curious to hear others' thoughts as well.
Yes, Anu.
I can chime in quickly, although it's hard to follow you, Nanki. Always, always, always gratitude. I'll just kind of position this or ground this in someone who's worked in healthcare as a health promoter, and also as a consultant, also worked in the hospital system, and who sometimes gets kind of tapped to ask about organizational change. I think, you know, one of the kind of working assumptions in the question is that it isn't possible to imagine doing both of them at the same time, similar to what Nanki's saying. And so I want to actually push for, you know, using strategies of collective daydreaming, because I think one of the biggest challenges that I've experienced and I've faced is that people who are working, whether they want to frame it as within the system, they actually can't imagine what something else could look like. And because there isn't that imagination, the idea or this message of like dismantling actually becomes something really, really scary, and people get defensive. There is some ego work that people need to do because people are worried it means like losing their jobs. And for some people, it will be changing your job. So I think, you know, yes, we need to dismantle, and yes, we can work to make sure that people are actually honored for who they are and provided with the most life-affirming care that they can get. And also, we need to be able to create the conditions for everyone to be able to daydream and collectively work together in pods sometimes to make the world that we all need and want.
We can definitely go to the next question, but it just made me think about just a reminder, and this is something that I have to remind myself of every day, is also just being really honest with the limitations that are inherent to the institutions that we are practicing in, so that we're not actually going in with a particular idea of what dismantling looks like, and completely echoing all of what Anu said in terms of collective daydreaming and ensuring that we're someone recently reminded me, ensure that you're in spaces that actually restore you and that keep your creativity and your sense of resistance alive, because that's a lot of the work that these institutions are trying to actually strip away from us. So really ensuring that you remain in community and are connected to people who are holding you accountable, but who are also building you back up too as you continue to do the work within institutions.
Amazing. Thank you to you both. I have a tiny response to that, but I just still want to leave it open. I think this is actually going to be our only question that we get through our Q&A, because we wanted to leave as much space as possible for the youth panelists. So unfortunately, we won't be asking any other questions. So for anyone else who's behind the scenes that would like to respond to this question or comment on anything Naki or Anu has said, then now is your time. No, that's okay too. So I just wanted to make a comment about the idea of collective daydreaming, and just bringing that back to our original needs assessment, which has completely informed our recommendations report. So why we're here today. So in our original needs assessment in 2019, a lot of our questions were framed in a way using the literal words like, this question is for dreaming, this question is for imagining a different future. And asking the youth who participated in this needs assessment basically how the world can look different. Like what do you want to see? Like what needs to change? If you could dream of anything to happen right now, what would it be? And from those almost 1,200 responses, majority of those responses were really rooted in like the really, really, really basic stuff that should already exist, which have directly informed these recommendations. So for example, one of the most common responses to that question of those almost 1,200 youth was gender neutral washrooms. Just let folks have a washroom in public spaces. Wanting politicians and people in positions of power to listen to 2SLGBTQ youth. Another one like safe healthcare for 2SLGBTQ young folks. So just reiterating that point of collective daydreaming, it's like different futures are possible. Like things can change, we can change them. So just, yeah, bringing that back to collective daydreaming of like, that's actually where this started and the direction we were trying to head towards. And one thing I like to name about the recommendations is that these are not collective daydreams. These are like the basics, like, come on, like they're just the basics that folks should be doing already, that should already exist. And folks have been saying these recommendations for generations. So it's time for us to do better. And with that being said, if Shivani, if you can put on our last slide there. So we have 3 minutes left. We're very on time today. So just wanted to name a couple of next steps because y'all are here, but the work doesn't end here. So first things first, please fill out our survey. We have a very quick survey that's anonymous that we want all of you to fill out. This survey is not just a feedback survey to like ask how we did in this webinar. It's actually mostly to provide us with feedback for what we can do in terms of next steps with this report, what we can do in terms of next step with the recommendations, like how can we support the work that you're doing to implement these recommendations. So the survey is really, really, really important. We really need all of you to fill it out so that we can determine what to do next and how we as an organization can support that. So that's step number 1, please do that. Step number 2, share the report. Please, please, please share it. We've had some questions coming in around like, have we invited politicians or folks in leadership positions? Have we sent it to like, our provincial politicians? Yes. The answer is yes, but also all of you here, you can also do that too. Please send it to everyone that you know, politicians, leadership people, family, friends, whoever. Send the report, share the report, talk about the report, and also use the report in advocacy. So if you are pushing for something at your workplace, please use the report. And just, yeah, it's for you to use. If there's any questions about that or ways to use it, again, please go back to the website. We have a whole section about how it can be used, or just get in touch with us. Step 3, order YouthLine outreach materials. So if you work in a place that is supporting people in general, youth in general, then you can order our outreach materials, things like posters, service cards that give folks our numbers and our contact information for our peer support line. We have our needs assessment reports. We can send you all of these things for free. So please, I know that there is a link in the chat that was just sent, so anyone can order those at any time. And the last thing, add your organization or supports to our resource database. So YouthLine does have a provincial database. It is front-facing. You can go in there and add your resource or your group or your collective or whatever that looks like in terms of supporting 2SLGBTQ youth, and that will be added to our resource database so that youth can find you, and also so that other service providers can find you. And then one thing I didn't name on here, the biggest step, like try to implement the recommendations in whatever way, like whatever your capacity is, wherever your workplace is, like work on the recommendations, please. That's what this report is here for. So I think that's it for next steps. 2 o'clock on the dot. So we can go to the next slide, which is just a thank you. Thank you so much for being here, especially folks in the healthcare field. Like right now, times are really, really challenging and hard. And I know everyone is so tired. So we really appreciate you being here and taking these next steps with us. Thank you to Anu and Shivani for presenting the recommendations. Thank you to our wonderful panelists and to Nanki. Like, you folks did such an amazing job, so many amazing conversations. And I'm really looking forward to continuing these conversations. So please fill out the survey. We'll send you an email soon from Zoom reminding you. And yeah, I think we will close from there. Thanks so much, folks. Hope to see you soon. Bye.